I want to talk about polyhydrominos in pregnancy. That is excess buildup of amniotic fluid while you're pregnant, because I experienced it. And when I found out that I had polyhydrominous pregnancy, I went on internet and online to make research about it. I couldn't find anything. Polyhydrominous is whereby there is excess buildup of amniotic fluid inside the uterus, where the baby is not swallowing enough amniotic fluid to be able to pee out enough amniotic fluid to swallow it back. That is the cycle that goes on during pregnancy. In my own case, I did a lot of tests. There are a few things that could cause it. Either it's infection, you're diabetic, or the baby has the neurological defect. I did test for infection and then diabetes, and all came out negative. So I was left with the option of going to do a fetal anomaly scan. This is a scan that shows all the developing organs inside the baby. I did this scan and the scan came out and my baby was okay. There was no known cause for my own. We couldn't find out what caused mine. But what I am saying is today, in that polyhydrominous, if there are things that cause your own polyhydrominous pregnancy, it can be managed. The doctor can manage it. If you're diabetic, there are medications that can manage it. And if you have infection, there are the medication, antibiotics that are safe to take while pregnant. And if there are other causes of your own, the doctor will be able to find out and be able to manage it. In my case, there was nothing, we couldn't find out anything that caused it. So the only option I had was to continue with my prenatal vitamins. And each time I go for my prenatal checkup, which is antenatal, I try as much as possible to do scan, because that excess amniotic fluid could also be making the baby positions to change, because there are enough fluid in your womb that the baby is not swallowing enough. It will making the baby in position to change. You might go today, the baby is sitting the other way. You go for another checkup, the baby